The Ford government is lifting most mask mandates by March 21st, including in schools when March break ends. And by the end of April, all public health measures will be gone. It is the next phase as Ontario moves to living with COVID.
If someone wants to keep them on, God bless them. If you want to keep your mask on, keep it on. If you want to take it off, take it off.
As of March 21st, the only places masks will be required will be in hospitals, on transit, and in congregate settings like long-term care. Then on April 27th, masks will no longer be mandated anywhere under provincial orders. The Chief Medical Officer of Health says that while COVID cases have been falling, it doesn't mean COVID is gone.
Removing the mask mandate does not mean the risk is gone.
Dr. Moore's messaging is people don't have to wear a mask, but they are encouraged to. In fact, Moore acknowledged he will continue to mask in places like malls and big box stores.
It is now a choice.
The decision to lift masking in schools right after March break is causing some experts to raise concerns. This statement from a children's health coalition that includes Sick Kids Hospital says they would have preferred if the government had waited 2 weeks until after the break was over.
But I think, a few weeks after March break would be a much more reasonable time to reassess mask mandate.
I worry about schools because the vaccination rate in the under 12 group is low. And of course, those kids are more likely to have siblings who are under 5 who are not vaccinated at all.
Toronto's mayor and medical officer of health today both indicated they are aligned with the province on masking.
I do support the decision. We are in a very different place in the province, and certainly I can say in the city at this point in time, compared to where we were even just a few short weeks ago.
Today's announcement also includes new guidelines for people exposed to COVID. Effective immediately, they don't have to isolate if they come into contact with a positive case outside their household. And provincial vaccine requirements are also being dropped as of Monday, which means an unvaccinated person can work in a hospital or long-term care home unless the employer has a policy preventing it.
I've been probably accused of being the most cautious leader in North America when it comes to this pandemic.
Ontario has had more lockdowns and school closures than anywhere in North America. Dropping all mandates by the end of April coincides with the upcoming provincial election, which is expected to be called in early May. The Premier insists the timing is not politically motivated.
Let me be very clear, there's no pressure on Dr. Moore. I follow the advice and the recommendations of the Chief Medical Officer of Ontario.
The opposition, though, isn't buying it.
We have seen this government make decisions based on politics instead of public health advice over and over again. I mean, they walked us right into the third wave with their eyes wide open.
The Ontario Hospital Association today said masking to protect patients will likely be required in hospitals for some time. It also indicated a vaccine mandate for employees will remain in effect. The challenge for the Ford government now is to convince people the COVID threat is over. After 2 years of warning of the dangers, it will take a psychological shift and for numbers to continue to fall.